Hello and good evening, everyone. I am Dr. Aman Khera. I'm co-founder Care for Parents. Thank you, everyone, for joining in today. Today, we are discussing about constipation. Constipation is a very common word. Everybody knows about it. Everybody has experience about it. You must be wondering that why we are talking about this today. Constipation definitely is a very common condition, but a very, I would say, a less talked about condition. People don't like to talk about that. And it is, you all know that constipation affects anybody and everybody. There's no age group which is, which gets, which escapes this. All age group people have been suffering from constipation off and on, depending upon whatever time it is. As I said, it's a very common thing. People, 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 when they suffer from constipation, they do not realize that what to be done, what is to be done, how to tackle the situation. Today, being so common, you will be surprised to know that it is the most common problem, stomach related problem, for which people go to visit a doctor. It can, as I said, it can occur at any age, but as we grow older, as we cross the age of 60, 65, it is found that the chances of developing constipation increase. Again, you'll be surprised that above the age of 65, almost 20% of the population is suffering from long-term constipation, what we call the chronic constipation. Now, for all those who have attended my seminars before, I have mentioned one thing, that whenever there is a condition which is very common, two problems get associated with that. One is that a lot of myths, start spreading about that. You hear, because it's a common condition, everybody's talking about it. They say that, family members will say, you take this, you take that, friends will give some suggestion, and these do not have any scientific basis. So eventually, what happens is sometimes we are able to manage that situation, and sometimes we are not able to manage, and sometimes we can even cause a problem, cause a further complication. The other problem that occurs when a situation is very common, like constipation, is that people tend to self-medicate. They think that's very common. So, we can take any medicine that is available. The medicines for constipation are very easily available in the market. They are available over the counter. So people tend to, unknowingly, they tend to self-medicate themselves, probably over-medicate themselves, or take medicines without even consulting a doctor or a specialist. And this can sometimes become a problematic situation because, you see, for constipation, there are various different reasons. And all of them have a different sort of a treatment. So, without getting a proper consultation with a specialist or a doctor, when people tend to medicate themselves, it can cause a problem. So, today, to discuss about this situation, we have invited Dr. Vibhu Mittal. Dr. Vibhu Mittal is a gastroenterologist. He's DM in gastroenterology. He's associated with Max Hospital of Vaishali and Max Hospital of Patparganj. Dr. Vibhu is a close associate of mine. I've known him from last 15 years. A very good experienced gastroenterologist. So today we have invited Dr. Vibhu Mittal to, discuss certain common questions that come in our mind, to discuss about, to remove the myths which we have in our mind, and to clarify any doubts we have regarding this condition, because at any point of time anybody and everybody suffers from constipation. So thank you very much, Dr. Vibhu, for joining in today and taking out your time. My request,
Thanks, Dr.
my request to everyone is that please feel free to talk to him, to ask him any questions if you have in your mind, to clear any of your doubts. So today, Dr. Vibhu, we'll be starting the session. I'll be starting with very simple, request to you and a simple question, that can you tell the audience briefly that what is constipation? When do we say a person is constipated? Just to give a brief introduction about constipation.
Yeah. So, as rightly pointed out by you, it is a very common problem which is faced very commonly in elderlies also. But when we say define constipation, it is classically defined as passage of hard stools or passage of stools less than 1 in 3 days. So this is the classical definition of constipation. If I have to talk about this in a less scientific manner, maybe a clinical manner, then I'll say any change in your stool frequency or stool form. Whatever you are passing, उससे stool अगर थोड़ा ज़्यादा hard हो गया है या frequency कम हो गई है, that can be taken as constipation. In our clinical practice, many individuals come to us saying that they're passing liquid to soft stool, but this is constipation. No, that cannot be managed as constipation. So if you're passing liquid to soft stool, this would not be classified as constipation at all. Patient may still have that sensation of incomplete evacuation, साफ नहीं हुआ और लगता है, पर वो एक अलग सबसेट है ना, उसको हम कॉन्स्टिपेशन जो हम टिपिकल कॉन्स्टिपेशन की बात करते हैं उसके साथ अटैच नहीं करना. सो once more, constipation is hard passage of hard stools or infrequent passage of stools.
So this is very important, because like yes, in our clinical practice, we do come across times when people say that we are passing normal stool, but पेट साफ नहीं होता, complete नहीं होता. That's a different matter altogether. But yes, if it is a hard stool and if you are passing less than, as what Dr. Vibhu has said, there's a problem in passing, you're not able to pass in 3 days, then there's a condition. We say that yes, the patient is complicated.
So
yeah,
just for Western population, the initial cutoff was once in 3 days. For Indian population, now we say change from your previous. So if you were passing 2 stools a day, morning, evening, which is very common in our Indian population with the kind of vegetarian high fiber diet which we used to take, which we are still taking. So in that, even if somebody was passing 2 stools a day, one morning, one evening, and is now passing 1 stool a day, this can be classified as constipation. So a change from your normal habit is a constipation if it is associated with a slightly hardish stools.
So this is very important, because change in the pattern should be a sign in which you should probably consult a doctor at least once. So, Dr. Vibhu, tell me one thing. As I said, and as it is known that constipation can occur at any age, but is it true that it's more common in elderly, and if yes, then why does the elderly become more susceptible to constipation?
Yeah. So see, for regular bowel movement, few things are needed. One is diet, high fiber diet, lots of liquids, and exercise. These 3 are prerequisite for a regular bowel movement. Unfortunately, with advancing age, with or without additional diseases, so many of our seniors would have heart disease, kidney disease, would have water restriction, would have poor dentition resulting in a poor fiber intake. So your diet changes. Even if you want to take that, your fiber intake would go down. Many of these individuals are asked not to take adequate liquids. They're asked to take fluid restriction. So these things contribute to constipation. Then the activity patterns would definitely go down with each passing decade. So these 3 are the physiological reasons. Apart from this, lots of seniors are on a variety of medications. Many common antihypertensives, calcium preparations, iron preparations, even antacids, all these would contribute to constipation. So 1 and 1 and 1 and 1 becomes 1111 and not 4. So these things add up to increasing constipation in elderlies.
So tell me one thing, Dr. Vibhu, that you have mentioned the causes like this, the diet. So how do we, because see, medications are something which are inevitable. If a patient is hypertensive, he has to take the antihypertensive medicine. If the patient is, having antacids, so and as you said that a lot of medicines have they cause constipation. Then how do we, manage that? How do we manage the dietary? Because you are right that as you grow, the diet intake goes down. It is natural. I have this in the previous sessions also. Then how do we, try to control that? How can we avoid it? Can some dietary modifications help, or any lifestyle modifications help?
So if there are no other competing medical problems which have made changes in diet, like suppose a kidney patient would be asked not to take fruits, and then you don't start taking fruits for constipation. So the first thing is, अगर कोई और dietary restrictions किसी और बीमारी की वजह से नहीं, So everything said and done, fiber intake should be optimized. Now, many of seniors would have dentition problem. तो दांत नहीं है तो फाइबर नहीं खा पाते, है ना. सो उसको फिर फाइबर को हमें चेंज करना पड़ेगा. इधर यू मेक अ स्मूदी आउट ऑफ अ फ्रूट, उसको कद्दूकस करके क्रश करके whatever, है ना. और take fiber supplements. Lots of safe fiber supplements are available. So one is fiber, second is liquids. Again, if there is heart problem, liver problem, kidney problem, and fluid restriction has been advised, there is, in that case for constipation, you are not going to increase fluids. So if there are no competing medical problems, then an adequate fluid intake is important. And many of the times our seniors just are lazy or they forget to drink adequately. So take adequate liquids. So these are two important things which in diet everybody should take care of.
So you have mentioned two things. One is about liquids, adequate liquids, and dietary fibers. You said to optimize. Optimize is a very good word we have used, because increase or decrease is not the thing. It has to be optimized as per the requirement. But and what about anything to avoid to prevent constipation? Can you give a brief about what should be taken, what causes constipation, certain dietary things which cause constipation, certain dietary things which are helpful in constipation?
So actually, what causes constipation in diet? There is nothing like this. So if your diet is low in fiber, so we frequently get patients who would say, मैंने कल chicken खाया था इसलिए मुझे constipation हुआ. My answer would be, it's not chicken which is causing constipation. Chicken has very less fiber. So आपने कल fiber नहीं खाया था इसलिए constipation है probably. So that is one part of the problem. Junk food has very less fiber. So junk food causes constipation probably because it has very less fiber. There are certain liquids, like I talked about liquids, but if we are taking lots of tea and coffee, we are taking that liquid, but that would cause increased urine, thereby decreasing the fluid in the bowel. है ना. सो चाय कॉफी ज्यादा पीने से पेशाब ज्यादा बनता है, और पेशाब ज्यादा बनता है तो उसी पानी के साथ बाउल में पानी कम रहता है. So that way tea and coffee to some extent, or if the patient is again on diuretics जिससे पेशाब ज्यादा बनता है तो उससे constipation बढ़ जाता है. पर से constipation करने के लिए कोई food responsible नहीं है. It is the amount of fiber which you are not taking. So for my young patients who would come and say, वो क्या हम फिर बाहर जंक नहीं खा सकते, तो I'll tell them, यार देखो जंक आपका एक लिमिट में अगर आपको खाना भी है, बस डू टेक फाइबर ऑन दैट डे ऑल्सो. एक बोल ऑफ सैलेड खा के आप बर्गर खाने जाओ तो कॉन्स्टिपेशन नहीं होगा. आई एम नॉट टॉकिंग अबाउट वेदर बर्गर इज हेल्दी, सेफ, एक्सेट्रा एक्सेट्रा. व्हाट आई एम ट्राइंग टू टेल यू हियर इज that it's not about what you eat, it's about what you do not eat with that food, which is the problem for constipation. So fiber is important for constipation.
I think Dr. Vibhu, you have said a very interesting thing. People usually say, don't eat this, don't eat that. You have said, eat anything and everything you want, but have your fiber component on that.
So that is for constipation. Don't generalize this. Saying that Dr. Vibhu had said eat burgers, eat all that. What I'm trying to tell you is, if you are focusing on constipation, obviously in a balanced diet, ensure that you have adequate fiber. If you are somebody who has constipation as a problem, then ensure that your each meal has fiber. किसी दिन कुछ cheat day भी है, उस दिन भी fiber ले लें साथ में.
So this is very interesting. I have heard today. I mean, I'm sure people will be very happy to hear that a doctor is first of all saying not to. There's no restriction on the diet. Normally,
again, that's only for constipation.
Constipation, yes, of course.
Yeah.
Of course. So that is that, yes, there's no restriction as far as constipation is concerned. Of course, we are not taking into consideration any of your other health-related matters, diabetes or heart disease or whatever. So it is primarily related to the constipation. Anything you can eat, that's very interesting. But yes, dietary fiber and water intake, that is very, very important. So if that is optimized and adequate, then I think this situation may not trouble anybody. And any suggestions about lifestyle modifications or any other thing which can help in preventing or treating this particular condition?
Well, lifestyle, again, these three things. ensure that your diet has fiber, you have adequate liquids, and the third important thing is mobility. Uh, Mobility in any form is better than not being mobile. So exercise is most welcome, yoga is most welcome. But even if you're not doing that, ensure that you are active. A bed-bound or a less mobile individual is likely to have more constipation.
So that is again important in the sense that exercise and activity. I think every doctor who comes and says that exercise is important for their part of the health related problem. So even if it's your stomach is concerned, exercise is definitely important. Dr. Vibhu, one thing I would like to ask you, which is a very important question everybody would like to ask, is the role of laxatives. You see, there are a lot of laxatives, lot of medicines available over the counter. So many times people tend to self-medicate, which I have said also in the beginning. So how to take a decision when to start a laxative? Should it be only under medical supervision, or the type of medicine or a treatment done for curing coming out of that situation of constipation? Can you just briefly describe about that?
Yeah. So even if we say this or not say this, whatever you might say that medicine should be under medical supervision, but in India, over-the-counter drugs and many of those drugs which cannot be which are difficult to prescription drugs even with prescription even in West would be available here freely. So I'll share few basic pointers for the general public here. Laxative जो भी आप ले रहे हैं, ensure that you do not overuse it. When I say overuse it, the target is a soft stool. Sometimes, even after soft stools, patients or individuals tend to continue or increase the dosages because वो साफ नहीं होता. Now, don't do this. The role of any laxative is to soften the stool. If your stool is already soft, that is the end point of laxative use. Do not overdo that. I frequently get my patients back saying, "Sir, वो ले लिया था, उससे पेट अच्छे से साफ हो गया. I passed 3 to 5 loose motions or watery stools." Now, this is not what laxatives are meant for. There are various classes of laxatives available, be it allopathic medications or Ayurvedic medications. The first is your fibers or the bulk forming. They're totally safe. Anybody can take them. There are lots of fiber preparations available in allopathy as well as Ayurveda. Your basic isabgula husk is a prime example of that. If you're doing okay with that, there is no problem with it. But medications such as we call them stimulant laxatives. These laxatives would stimulate your gut to produce stool. Now, these should ideally be taken under medical supervision as per need. I'll not say that they should not be used. A lot of my patients would be on stimulant laxatives, but we need to optimize their use. We need to ensure that they are not overused. I'll give you examples of them. For allopathic patients, the commonly known laxatives you would have heard them or used them would be Talcoflex, Piclin, Rimafin Plus. These are the stimulant laxatives. I'll say they are not for use without medical prescription. In Ayurvedic preparations also, the chuns, like Kayam churn or Pet Safa, all these are stimulant laxatives. So that is my take on laxative use, over-the-counter laxative use.
But tell me one thing. A lot of people you have, as you have said, and even we have experience in practice, people are taking laxatives for months together. So is it risky? One, two, is there something called getting addicted to a laxative or laxative dependence?
So there are two aspects of this question. The first is how long should laxative be given? Now, there are certain reversible and irreversible reasons for developing constipation. Suppose I had a fracture of my lower limb and was bed bound. was given some medications, antibiotics, painkillers. All this would cause constipation, and my need for laxatives would be there. Now, this would be a short-term use. We commonly see this in pregnancy or during diseases. The second, which is more common, is my tendency of my bowel to be slow now. है ना? So, which is functional constipation. Now, in functional constipation, despite best uh, lifestyle, if there is a need for laxative, the best suited laxative, it is not the best laxative, it is the best suited laxative. So let's take an example. मुझे सिर में दर्द होता है. Now disprin is the best painkiller, but it has side effects. है ना? So the best suited may just be a crucian pain relief. So अच्छा नहीं लेते हैं laxative. Laxative वो लेते हैं जो best suited हो. Best suited is जिस laxative से soft stool आ जाए, वो लेने की जरूरत रहेगी. कब तक लेने की जरूरत रहेगी सर? जब तक रिक्वायरमेंट है. So we don't we will do all our lifestyles, and उसके बाद will ensure that the medications are not contributing to it. We ensure that the electrolytes are okay, and if after that, especially in seniors, there is constipation, then laxative should be taken, because not taking laxatives has its own complications. The problem here is patient may not be needing a stimulant laxative, और वो लगातार stimulant laxative लिए जा रहा है. है ना? Patient may be doing okay with an osmotic laxative, which is better than using a stimulant laxative. Like just we answered the question कि यार डिस्प्रिन से दर्द, सिर दर्द की बढ़िया दवाई बताओ, डिस्प्रिन. It's not that I should be writing disprin for every pain now. है ना? Same goes for आपकी आपके ग्लासेस का नंबर कितना है? 6 नंबर है, मेरा 3 है. आपका चश्मा अच्छा, मेरा चश्मा अच्छा नहीं. आपका आपके लिए अच्छा, मेरा मेरे लिए अच्छा. So those are the concepts. It is not as if I'll say कि laxatives should be taken only for 3 months, 6 months. We should be able to justify their use. And if we are, then long laxative use may also be okay.
So that is very important. But the question again comes is, how do we know that what to try? I mean, is it by trial and error, or is it
If this,
we have to take a
so
doctor?
it again depends. It again depends how severe the problem is. Suppose there is fecal impaction. Fecal impaction is चूल आना बंद हो गया, सुते पड़ जाते हैं जिसको बोलते हैं ना. So if it is fecal impaction, we may need to start with a enema and strong laxatives to clear the bowel and then come down. And if it is not a fecal impaction, it's a slowly progressive problem, then you start from below and try to titrate it up. There is also everyone can look at it. Bristol's stool chart. Net पे freely available है. Bristol, BRISTOL, it is name of the city. Bristol stool chart. Now that's a very good guide of ensuring that the stool is okay. So Bristol stool chart 4 or 5 is the target. So if your laxative is able to produce this is okay. So if I say CD जैसा इलाज हो गया, तो पहली CD है bulk forming agents. Ispagula is an example, or if you are talking about allopathic medication, it would be cremodite kind of a thing. Next is osmotic laxatives, which would be lactulose, commonly available in polyethylene glycol, and then there would be stimulants. There are certain newer medications also, but I think I should not be discussing them here. So this is the common staircase-like phenomena. Obviously,
I think
do not even think of over-the-counter usage of laxatives if, apart from constipation, supposed constipation, an individual has significant pain, vomitings, or if it is a very acute onset constipation. Do not think of over the counter, because these things can be many sinister things rather than simple constipation. This discussion of over the counter usages can be for only somebody who is having some difficulty, which is not very bad in those situations.
I think you have very well explained how to manage that, because this is something which I'm sure people would be thinking. Dr. Vibhu, when a person starts a laxative for the first time, or maybe after a gap, how much time does it take for the effect to come? This is the reason why I'm asking this question is people say मैंने कल क्रेमाफेन दिया था मेरे को आज भी मेरे को मेरा पेट साफ नहीं हुआ क्या मैं डोज बढ़ाऊं should I increase the dose or what
Yeah.
so what is the action time the time to bring a reaction on the medicine taken
Again, sir, it would depend on what medication and what dose are we using. So for a bulk forming agent, for Ispagula, I'll say wait for a week or two. For osmotic agents also, I'll say which are lactulose and polyethylene glycol, take some time, wait for 3 to 7 days before saying. For stimulants, my threshold, especially I'll be using stimulants in somebody who has a severe degree of constipation. My threshold would be low. But then again, when a patient comes back to me saying कि फायदा नहीं हुआ या incomplete फायदा है, I end up showing a Bristol stool chart. Stool कैसा है? अगर stool soft है, we are not discussing increasing medication with you. है ना? क्योंकि वो Cremofen plus लिया था, stool तो soft हो गया, but I'm still not feeling relieved. This does not mean you need to increase the medication. But a general thumb rule would be 3 to 7 days before talking about that it's not working.
So this is very important, 3 to 7 days. That's a long time because people think. I mean, everybody has a feeling कि मैंने आज दवाई ली है, कल ली है, तो मेरे को it should, the reaction response should happen. It may take time, so that is a very very important thing that we all should remember. We all should remember. There's a question put up that any general suggestion for good gut health. Now, this is a very interesting question because good gut health is something which everybody likes, wants, because then you can eat anything and you can, you feel more comfortable.
This goes beyond constipation, but yes, for good gut health, what is suggested is probiotics. Natural probiotics would be curd-based diet, and usually adequate fiber diet. Fiber are good for our gut. On top of that, things to be avoided would be processed food, food which are rich in saturated fats, which would include lots of red meat based diets. So these things are best avoided. Food जितना natural form के जैसा होगा, कम से कम processes के साथ, उतना ही gut के लिए वो ज़्यादा अच्छा रहे. So a vegetarian diet which is with lots of fresh fruits, vegetables, nuts, and curd would be good gut health. Milk is also not very good for the gut. Milk and milk base, apart from curd.
Milk is not very good for gut, you said.
No.
Okay, that's
Curd
something.
is. Curd is.
That's something new we have heard. That's interesting.
Hello.
Yes, Mr. Rao, please say.
See, actually, my age is 85 years. I have been a long time diabetic patient. And recently it was found out that I am suffering from this diabetic neuropathy. See, one of the, one theory is whether it has affected my entire digestive system because I am not feeling hungry, high constipation. Is there any chance for the neuropathy to affect the digestive system, affecting the intestines also? And
Yes.
now I am a chronic, I am a constipated patient. Using all these medicines, nothing is working for me. Can you please help me?
So yes, so neuropathy does affect the bowel. In some individuals, it would make them constipated. In some others, it would make them cause them diarrhea. So that may be one of the contributing factor in your constipation. If you're already tried many medications, sir, I'll still suggest you see a gastroenterologist because on this forum like this, I cannot just say start taking this. So we can talk about general guidelines like this, but if you're already taking some medications, then we might need to try combinations. And the best person would be a physical consult with a gastroenterologist. One thing I'll again talk about here is the medications ensure passage of stool. These medications cannot do beyond that. And sometimes with the kind of neuropathy you might have, you might feel even after passing stools that pura saaf nahi hua. For that, constipation medications would not help you. If your constipation is not being relieved with medications, which means you are still passing hard stools or not passing stools at least daily or once in 2 days, then definitely your constipation medications would need some tweak, and you should meet a gastroenterologist. Sometimes low sodium, which is very common with diabetics, or changes in your kidney test may also be contributing to it. Your drug history should be looked at, and an offending drug, if found, may be substituted. So, like we were talking about blood pressure, hai to dawai to khana padega. But there are medications which may not be causing, which may not contribute to constipation, and they can be used rather than using the typical drug you might be on.
Hello.
So,
See, what is this word? Gastroparesis.
गैस्ट्रोपेरेसिस का मतलब होता है सर, जो आपका स्टमक है गैस, उसका पेरेसिस स्लो मूवमेंट, so it becomes slow and is very common problem with long standing diabetics.
Is it reversible? Is it reversible?
Sir, gastroparesis, if because of diabetic neuropathy, would not be reversible. Gastroparesis because of some other reversible reasons would be reversible. For gastroparesis, you would need some help with medications and tweak of your food. Like with gastroparesis, we usually tell our patients to take 4 to 6 small meals. So instead of taking one or two meal, thoda thoda khana bar bar khaiye. I'm not asking you to increase your intake. I'm asking you to divide it into smaller meals.
Sorry, I'm asking one more question. This gastroparesis, is it because of this neuropathy or not? Is it possible for us to find out due to some investigation?
Okay, so there are no direct tests for looking at what is the cause of gastroparesis. There are multiple reasons of gastroparesis, and your doctor will look at them on history and your labs to find out if there is something else. Like this can be also because of problems with your labs, high calcium, low sodium, certain medications, thyroid problems, poorly controlled diabetes. So whatever the reason be, those can be corrected. There is no specific test which would look at and prove that this is because of this. There is a manometry kind of a test for stomach also being developed now, but it's not widely available. And at present, even if somebody does your manometry of the stomach, not the esophagus manometry, which is readily available and has clinical utility, it would not change your management. So I don't think we should be going into the territory how to prove that this is this.
Okay, thank you very much. Right now, I think my problem will be sorted with the high fiber food, isn't it?
Sir, in case so let's take an example of diabetes. I have diabetes, and my problem would be solved with the diabetic diet. No, this would be the wrong answer. If my diabetes is very borderline diabetes, then my solution is only a diabetic diet and exercise, and to take care of that. Sugar, then I'll need insulin, I'll need medications apart from diabetic diet. So similarly for constipation, if I have a borderline type of a constipation, then my problem would be taken care of by following the lifestyle. In situations where the constipation is more than that, then you would need lifestyle and anything else. Like in your case with diabetic gastroparesis, it will take lots of fiber. That will be counterproductive. आप खा नहीं पाओगे, है ना? So whatever we are discussing or I'm telling, it's not for specific cases. That's for a situation where we are only have constipation, and in seniors there are multiple problems. So that's why I was initially stressing on one thing. If there are no competing problems, then this is it. And as soon as we talk about diabetic gastroparesis, the fiber tolerate ही नहीं होगा, कम रखना पड़ेगा.
Thank you very much. I think I'm gained a lot of knowledge after hearing your speech. Very, very thankful to you.
Dr.
Vibhu, there are two questions on the screen. One question is, how much fiber should I add to my diet? So that is the way we're using optimize it. So there is now quantitatively they are asking, and is taking supplements of fiber good?
Okay. So requirement for everybody is different. My general rule is I'll tell my patients to take at least a serving of fiber with each meal, especially if they are obese. Okay, your छिलके वाली दाल, multigrain आटा, है ना? So these are through natural food, taking sprouts. So till now, I'm not talking about adding fiber. Now, if I'm taking all this diet, then probably adding an additional fiber supplement is not going to help. So suppose my diet is not all this. I cannot take this. I do not want to take this. Then yes, fiber may be attempted. 10 to 25 grams of fiber supplement may be taken every day. Is safe for long-term usage, but you should always up titrate it. Suppose somebody starts with 25 grams straight away, will not be able to titrate it, will not be able to tolerate it. So the general thumb rule is start with 10 grams. You may divide it into two doses, 5 grams in the morning, 5 grams in the evening, or may take 10 grams straight away. Try this for a month or so. If you feel like you're comfortable with it and you want to increase it, it can be increased. If I'm already eating lots of fiber in my diet, like I am personally eating lots of fiber in my diet, so I don't take fiber supplements.
And
Sometimes,
now,
sometimes because of dentition predominantly or poor intake, it sometimes is not possible. है ना? I don't feel like फल नहीं खाए जाते डॉक्टर साहब अच्छा नहीं लगता है तो ठीक है these natural foods would have other benefits also but if you're talking about fiber per se then supplements can be added that's their say.
there's another question which is someone's asking, can constipation kill you?
Okay, so constipation cannot kill anybody. Constipation is just a symptom. If there is so let us can vomiting kill you, can fever kill you, all these are symptoms. Fever would not kill anybody, but if that fever is because of say typhoid which is not treated, people used to lose life. Similarly, constipation would not kill anybody, but if in the background of this constipation there is a serious bowel problem, then that may result in negative outcome also.
Dr. Vibhu, there is one thing. The next question which I wanted to ask you was, and is very common in a lot of families and people. There are some very old senior people who are probably bedridden because they have had a stroke, or they have had some, or they are bedridden because of their, they are immobile due to any reason. They have had surgeries, so they tend to develop constipation. That be A, prevented, which of course you said of some of it. B, if it happens, then what to do? Because the patient may have a restricted diet. He may be a cancer survivor. He may not be able to take much, and he maybe he's immobile. So how do you suggest that this should be
this
tackled?
subgroup is one where I'll talk about an aggressive use of medication. This is a subgroup which most commonly end up with bowel fecal impaction. And sometimes which contribute to urinary tract infections, sepsis, etc., etc. So any patient who cannot communicate is dependent on you for care. One part of that care should be ensuring that this patient empties his bowels at least once in 2 days. You may end up using enemas frequently. I'll not have any problems with that. Obviously, our medication should be looked at, and if needed, stimulant laxatives should be used. But these patients should ensure that, but the caregiver should ensure that these patients are passing stool at least once in 2 days. डाइट और फ्लूइड में जितना कर पाएंगे डिपेंडिंग ऑन व्हाट द मेडिकल सिचुएशन इज उतना करना चाहिए है ना फाइबर ट्यूब से भी दिया जा सकता है और इनमें वो हो नहीं पाता सो मेजॉरिटी ऑफ दीज पेशेंट्स वुड हैव would be contributing to their problems low fiber low liquids but then we need to manage them with medications if needed.
So this is very important for everyone to know, because we do come across a lot of our customers, patients who are bedridden, or I won't say bedridden, but they have got a very restricted mobility. They have continuous caregivers, so they do develop constipation and very frequently. So this is very important. One has to understand that if that patient is not passing stool once in 2 days, then there is a problem happening. So the target has to be that at least once in 2 days he should evacuate. And of course, as what Dr. Vibhu has said, the combination has to be done, whether as far as the food and the liquids and the whatever diet is being given, and of course aggressively medicate if required, because they cannot communicate with us, which is very important. They cannot express properly that there's a problem, and probably they cannot move every time to a doctor. So their aggressive medication is required. There's a question which says, is alcohol? Very important question.
No, alcohol is not constipating, but like there would cause lots of urine production. So alcohol is not constipating, but you end up looking at your fluid balance. Now, if your fluid balance is going to be negative, then alcohol will be constipating.
So as like what you have said, that anything which increases urine production which basically reduces the fluid content within the body, can cause constipation. So that goes for alcohol. This is a question: when someone is losing weight, do we produce more stool?
No, not at all. The amount of stool produced may be very peculiar to your bowel and your food habit. Constipation would mean frequent बार-बार stool पे जाना और जोर लगाना, है ना? So this would result in perineal disease. So fissures, hemorrhoids, fistulas are all result of constipation. Apart from this, if anybody has urinary symptoms, which is very common in male elderlies, then constipation would also worsen them, and sometimes may also results in more UTI also, because it is worsening the urinary retention. So these are the common things which with impacted stool, you may have pain abdomen, poor appetite also. Otherwise, with functional constipation, those things would not come out.
So these are very important. Everyone who have suffered or who are suffering should keep in mind that they should not exert pressure while passing stool, because that can cause pain, that can cause bleeding, that can cause piles, and of course piles can cause bleeding. That thing we have to be careful about. We have to be alert about. Okay, Dr. Vibhu, in your practice, I'm sure you see a lot of patients who are having constipation. What do you think are the common myths which are associated with this constipation, and people, sometimes go on the wrong track as far as this is concerned?
Especially in North India, there is a very running myth: पेट साफ नहीं हुआ तो ये चीजें हो जाएंगी, है ना? So people starts to associate their headaches, body aches, anything and everything with पेट साफ नहीं हुआ, which is not done.
That means people come with things, with vague ideas that I will develop some sort of pain, headache, or neck pain, or maybe this because of the constipation, which is not. It's not.
I also end up telling my patients that cleaning of bowel or passing of stools also has a lot of things to do with our brain. Now, if I start running over my आज stool नहीं हुआ, कब होगा, तो वो और नहीं होगा. Forget about it. Just ensure that you're passing it once a day or once in 2 days. Don't make it your morning routine. All totally focused on stool कब pass होगा. So lots of times the patient comes to us saying, सुबह 5 बजे उठता हूँ, 6 बजे करता हूँ, 7 बजे करता हूँ, 8 बजे करता हूँ, 9 बजे करता हूँ, तो 10 बजे stool होता है. Well, I end up telling them, stop doing all that. Stool तब भी होगा. So stop focusing on that. वो symptoms को और बढ़ा देता है. It's something like 4 साल का बच्चा खाना नहीं खा रहा है, मैं प्लेट लिए घूमता रहता हूँ, वो खाना नहीं खाता. प्लेट रख दो एक तरफ, खा लेगा बाद.
So can anxiety cause constipation?
No, anxiety cannot cause constipation, but yes, if you have constipation, anxiety would increase your symptoms. You would feel more constipated on days when you are more anxious.
Okay. So
it's not the cause of that.
Anyone, please ask any question if you have any doubts. Today we have had a very healthy discussion with Dr. Vibhu, and he has taken out his time. So let's make use of his availability. And of course, in case anyone gets any, who has any queries, who would like to consult, do send us a message and we will connect you with Dr. Vibhu. through telemedicine or through physical appointments will help you in getting connected to him. There's another question which says, what percentage of stool and intestine stays behind after evacuating?
It's not about stool percentage. So a large bowel is a reservoir of stools. Only the stool which comes in the last part, the rectum and the sigmoid colon is empty. It's not always that once you have passed the stool, all the bowel will be empty. So no, there would be lots of it remaining in there. There are certain individuals who would go in again and again and then tell me that each time I go, I pass. This means it is not completely evacuated. It will never be completely evacuated. Not sure about that.
So I think we have had a very interesting discussion today. Anyone else would like to ask any question? So thank you everyone for joining. Thank you, Dr. Vibhu, for joining. Whatever, in case anyone wants to, again, as I said, wants to consult Dr. Vibhu or wants to discuss further about their personal any stomach-related issues, please send us a message and we'll definitely try to connect you with Dr. Vibhu. Thank you everyone. Have a great weekend. Enjoy. See you again next month with some more interesting another interesting topic for discussion. Thank you. Thank you,
Thank
Mr.
you.
Dr. Thank you, Dr. Vibhu. It was a pleasure talking to you, and thanks for joining in today.
Thank you very much.